Oh. Grand Rising, Houston, downtown, midtown, third ward, fifth ward. Those of you listening in the car at 102.5 FM, Grand Rising to you that are tapped in through our free KMAZ app. And Grand Rising to you that are listening on our website at www.amazing1025fm.org. I'm Amanda Sapp here at Amazing 102.5 FM, your do good through good station where we're changing lives one listener at a time. I'm so excited about these guests that I have here in the studio with me on the airways with me today. We're having an important conversation about Black health, medical equity. Oh, I get my words right, and community empowerment, all centered around a life-changing event happening this Saturday. That's right, this Saturday here in Houston, Texas. But first, I want to share with you a little bit about the first guest that we have on our airwaves. She is a powerhouse entrepreneur and advocate for health equity. She is the co-founder and chief development officer of Acclinate. With a bold approach rooted in transparency and innovation, she's helping to revolutionize how underrepresented communities engage with healthcare and clinical trials. Through Acclinate and the Now Included platform, she's leading a movement that connects culture to care and is breaking down barriers in medical research access. She has raised over $10 million for this access, and she's raised over $10 million for the cause and continues to champion equity through bold leadership and national recognition. Ladies and gentlemen, please welcome onto our amazing airwaves, Tiffany Whitlow, Grand Rising.
Yay. Thank you. Thank you so much. I'm so excited to be here. I'm going to live up to like 2% of that bio. That was great. No, thank you so much, Amanda.
We're so glad to have you on the airwaves with us today. Now, you didn't come alone. I want to first tell me 3 words to describe you. Then I want to introduce the next guest that we have on the airwaves with us. Give me 3 words to describe you.
Oh, that's so good. Bold, innovative, and transparent.
I love it. And now this next guest that we have on the airways with us today, she's the Senior Director of Community Engagements and Partnerships at the Multiple Myeloma Research Foundation. She brings a rich background as a licensed pharmacist, educator, and health equity advocate with deep expertise in building trust and improving outcomes for underserved communities. At MMRF, she's leading initiatives that focus on outreach, awareness, and long-term solutions to combat rare diseases like multiple myeloma, which disproportionately impacts African American communities. Ladies and gentlemen, please welcome onto our amazing airwaves, Dr. Ola Banjo, PharmD. Welcome to the Amanda Sapp Morning Show.
Good morning. Thank you for having us on. I'm so excited to be here.
Dr. Ola, I also need you to give me 3 words to describe you.
I figured that was coming. No worries. I will go with, I love Tiffany's innovative. I'm going to take that one. Empowering and just, I'm a patient advocate. I know that's 2 words, but give me some slack on that one.
She's creating her own rules. Okay, got it.
I recognize that, and I'm so excited to have the both of you on the airways with us today. The both of you are part of a team behind the 2025 MMRF Community Connect event happening this Saturday, June 28th from 10 a.m. to 2 at the KBC Houston, and you're going to want to share all of this information with our listening audience. Now, I want to start with you, Tiffany, if that's okay. Acclinate is doing groundbreaking work to build trust and representation in clinical trials. Can you talk a little bit about how Now Included helps turn awareness into action in communities that have historically been overlooked?
We understand that through lived experiences and shared perspectives, people are able to make change. And so on our Now Included platform, you can meet people just like yourself who are going through life, who maybe weren't aware of clinical trials, who need to be aware of clinical trials, but who are also just going through life, right? Might be having mental health issues, might have just suffered through postpartum depression. And so it's really a community for everyone. We see a lot of advocacy groups focused on specialized outreach. And so we wanted to make sure we had a platform that was available for everyone at all times. And so we always say we're always ready and always on, but we're really on a mission to empower 1 million people to take actions towards better health. And so that could be going to the doctor, that could be participating in a trial, that could be coming to an event like this weekend and leaving with education that you can pass on to your loved ones in case you ever encounter multiple myeloma or someone with multiple myeloma.
Now, had you had a lived experience that made you decide, hey, I need to start Acclinate. We need Now Included. What made you decide to come up with these platforms?
Yeah, I think that bold part comes out in Now Included, because I felt like what the industry was missing was a place for people to be purely educated and aware. Don't be forcing opportunities on me. Don't come to me just because you want me to participate in your clinical trial. Like, come to me when you don't have a need from me type
That's right.
situation.
You talk about it.
On the personal side, I was given it for adoption because I'm biracial. So my biological mom kept my 4 Caucasian siblings. So when people say like, oh, there's all these discrepancies and races, that was my lived experience. And I grew up not really knowing much about my health history. So when I became a mom at 19, I had to make healthcare decisions for someone else. My son was diagnosed with asthma, and I had no idea what a clinical trial was, especially not at the age of 19, because no one ever told me. And I definitely didn't know that albuterol, one of his prescriptions, was 47% less effective in African Americans and 67% less effective in Puerto Ricans. So your same face was mine. I was like, what? Like, where was I supposed to learn about this in school, at home? Was this a dinner time conversation? And so it's really an opportunity for us to just be real. Like, there are things in life that you don't know. And as long as you're going to be a lifelong learner, we're going to continue to educate you and bring you along. So I'm excited to be able to work alongside pharmaceutical companies to make sure that we have greater representation and that the drugs that are being created today are as effective as possible for the majority of the population.
Thank you for sharing that. There's a lot to unpack with all of the other things you mentioned about family. I would dive deep into that, but I know we're short on time because my eyes is only a small example, but it's in my head. But at any rate, I digress. Dr. Banjo, am I saying your last name correctly?
You are, yes.
Okay. Multiple myeloma often goes undetected until it's too late, especially in Black communities. What are some of the biggest myths or misunderstandings about this disease? And how do events like this one that is coming up this Saturday help address them?
Well, I mean, that's a great question. So when you even talk about the biggest myths about this disease, let's first of all start off with folks not even knowing about this disease. So there's just the general sense that we've never heard of it. So you hear patients at the time of diagnosis, they're like, what? Can you spell it? How do you say it? I've never heard of it. But then as they start to dive deeper, they find out, wait a minute, it's a blood cancer. And, oh, I think I had a family member who might have had the same thing. And then they start to hear about some of the signs and symptoms of multiple myeloma, and then it all kind of hits home. But one of the problems with multiple myeloma being diagnosed so late is that it really cuts into the efficacy of therapies when we can't tackle it at the early onset. The earlier a patient can get in to be seen, and the earlier they can have a concrete conversation with a myeloma specialist, the better their outcomes are. So events like this that we're hosting this weekend, it really highlights multiple myeloma. And some folks will say, well, why do the general community want to know about multiple myeloma? But just the attendance and the amount of interest that we've had so far means that people are starved for information. People want to be empowered. They want any kind of information to help them get better. And knowing about multiple myeloma, hearing about it, understanding the signs and symptoms, and then more importantly, having these community events that link you with local resources really empowers folks in that room to know what is the next logical step if this ever affects me or a loved one.
Now, I want to talk to both of you about storytelling here, especially from survivors and thrivers. Play a role in changing the way people think about health, research, and early detection. Can either of you share a story of impact of how your platform may have connected with someone that gave them broader opportunity? Or Dr. Banjo, where you shared about a research clinical trial option and someone came, attended, signed up, and now they are better. I mean, would both of you please, if you don't mind, sharing a story of impact for us? We'll start with you. Yes, please.
Yeah, I can jump in and give you just an example of what we've seen at the MCC events. And one of the things that I absolutely love is when we have multiple myeloma survivors, or thrivers as we like to call them, and their personal physicians at the event, because it shows a healthy dynamic between a patient and a physician, what that relationship should look like, what those conversations should be. And then when the physician says, well, I approach my patients about clinical trials, and this is how I talk to them about X, Y, and Z, and then we reach that shared decision-making, like we call it, and then to have the patient then confirm and say, absolutely, That was how the conversation went. These were the questions that I asked you in return. And this is how you communicated that to me. And I love seeing that light bulb in the room. And they're like, wait a minute, I can have like human conversation with my care team, and we can have a really like sustainable dialogue. So really having folks understand that this is within your reach, and you can have a healthy working relationship with your care team. It's not just you going in and accepting whatever you're being told, but not really understanding. So I love breaking down those barriers when we have these events.
Thank you,
Yeah,
Dr. Ola. And Tiffany, I want to ask you the same. You got Acclinate, you've got Now Included. Tell us how when people connect with your platforms, how they are better.
Yeah, 100%. I love when someone is able to come and share their story and meet the other person whose life is impacted by their story. And so I know right now we're actually planning another event with Ola in the Charlotte area. And one of the young ladies that's helping to lead those efforts was at an Atlanta event that we did. And so this is really us traveling around the United States to make sure that each of the local communities is educated properly. And through that, you see these shared stories and shared perspectives where so-and-so is like, oh, well, I went to this doctor. You should go to this doctor. We've seen people change their doctor, change their course of actions because of an event like this. And it's like, I got to see a real person in 3D, right? It wasn't just, somebody, especially with AI. People are like, I don't know who to trust. I don't know what to trust. Well, like, you're going to trust someone's personal story when they're in front of you. And so I just really think that the impact, and I always tell my team, like, it's that one life that we're trying to reach is the most important. I also reach, I know at the Atlanta event, I met some of the healthcare providers who are like, we've been dying to get outside of our practice. We've been dying to get outside of those walls and like make sure that my community understands that I'm here, that I'm a resource. And so this is a great marketing opportunity, especially with, we have a lot of experts coming from MD Anderson there in Houston, and really want to make sure that Houston knows that y'all have the expertise here. You might just be lacking some of that early education and awareness that allows you to empower yourself and your family members through these shared stories and lived experiences and perspectives.
Now, thank you for sharing that, Tiffany. Now, what are some of the most powerful moments or breakthroughs you've seen in this work, either from families or people that you've met in communities or that you've partnered with?
Yeah, I know this sounds a little redundant, but I have seen people who believe they were diagnosed with one thing, leave an event like this, go back to the doctor, do additional testing, and tell their doctor, I think I have multiple myeloma, and the doctor wasn't even as aware. And so we see that earlier when we started this work, there weren't a lot of people that were prescribed, that were diagnosing multiple myeloma. There were a lot of people who were misdiagnosed. And so we've seen people have actually changed their whole course of diagnosis through this early awareness. And it's really like, when I started by saying like, we're working to empower people, like it's really about empowering you to go to your doctor and say, I want this test, this test, this test. I need to know if I have this, this, and this. When we weren't doing that, we were just going to Dr. Sick and saying like, oh, okay, you think I have this? Okay, I'm leaving my prescription. Bye. Now this is about empowering us to stand up for ourselves, stand in the gap for ourselves.
I love that, Tiffany. And here's my question. First thought comes to mind. People say ignorance is bliss. Why do you think people don't want to go and ask all these questions and need to know? Some people just don't want to know. They don't even know what to ask. If they do ask, Dr. Ola, can you speak to this? Am I saying something crazy? Do I sound crazy?
You don't. You are spot on. And this is what we address at the Community Connects, the Multiple Myeloma Community Connects. It is ignorance is not bliss. Education is power. Mm-hmm. Awareness is power. And you going head on and taking that proactive approach to your health, trust me, it's so much more fulfilling than being in ignorance or just hoping, crossing your fingers and toes and everything else that everything will be okay. So, we say when you are armed with this information, you are empowered, you're in the driver's seat. You know what you should be asking. And to your point earlier, sometimes folks do want to be in that driver's seat, but they don't know how, or they don't know what questions they should be asking. Mm-hmm. So that's the other thing that we speak to at these events. These are the questions you can ask. These are the resources that you can use. You can, at the MMRF, we have a patient navigation center. You can call our nurses and they will talk you through, help you kind of decipher that information, give you, more pointed questions you can take back to your care team. So you have partners. You have partners with the MMRF. You have partners with the Now Included team that will literally help you through every step. So don't feel like you're doing this alone.
Tiffany, who should come to this event this
Everybody,
Saturday?
because earlier she said, don't be starved with information. You are not leaving this event starved. We are serving you free breakfast. You're going to have free lunch. There will be giveaways. You have an opportunity to win $100. I mean, it's just really a fun experience. We try to make sure that it's an experience and not just something that you're coming to and sitting down and listening in. And so really it's for everyone, whether you are a multiple myeloma thriver, whether you know someone who has been impacted, whether you've never heard of multiple myeloma before. If it's hot in Houston and you need something to do indoors, I hope to see you there at 10 a.m. on Saturday.
I love that. Now we have to wrap this interview up, guys, and I want to start this with making sure that we like to leave our fans with something inspiring, something empowering, something they can take with them the rest of the day, the rest of the weekend, all the way up to the weekend. We'll start with you first, Dr. Ola Banjo. What would you like to leave us with today?
You know what? I'm going to say something that I said before. Education is power. And, with that education, you can arm yourself for the best possible outcomes. So there's so many ways to take control of our health, to really empower our families and friends. So even if folks can't be in the room, it's virtual. We give away handouts. You can take it and share it with them. We have folks calling us after for more information. So, come in knowing that you are going to leave fed, like Tiffany said, not only physically, but also emotionally and mentally. We check all the boxes. So come and join us. We'd love to see you.
And Dr. Ola, how do we find you?
So we are at the MMRF.org. That's our organization. We're a patient-founded multiple myeloma nonprofit. And you can go on there and check out our resources. And, again, tons of information to offer. And we are happy to help every and anyone. That's our mission. And we stand firmly by it. So very excited to hear from folks.
And Tiffany Whitlow, co-founder of Acclinate and Now Included. What would you like to leave us with today?
I think I will leave you with, if you want to change the world, you need to go home and love your family first. And one way to love your family is to come get great education and resources so that y'all can make the most informed healthcare decision.
I love that. Ladies, I want to thank you both for being my guests here today on the Amanda Sapp Morning Show. I want to make sure I got this event information correct. You guys are going to be here in Houston on this Saturday for the 2025 MMRF Multiple Myeloma Community Connect, Saturday, June 28th from 10 a.m. to 2 p.m. at the KBC Houston. You can join, all of us can join you guys at the Great Room 1500 at 6011 West Orm Drive, again, here in Houston, Texas. If people want to register, they can go online to nowincluded.com/MMRF/Houston. Is that correct?
Yes, or on Eventbrite.
Or on Eventbrite. And Tiffany, did you tell us how we can find you?
Now Included's website. I'm on IG. My name is not anything crazy. It is what it is. And I am always in the community. Download the app Now Included in your app store.
Tiffany Whitlow and Dr. Ola Banjo, thanks so much for being my guest here today on the Amanda Sapp Morning Show. Really appreciate you, your time, and all that you're putting out into the world. I also must mention to anyone that's listening, I'm your host for this event this Saturday. I'm so excited to be a part of the event, and we welcome all of you that are watching, that are listening, that are tuned in your car, online. Please, please, please join this event. Be a part of an experience that is truly making a difference. Ladies, thanks for being my guest here today.
Thank you so much. Thank you
for having us on.
We'll see you Saturday.